The Jacobi Medallion represents Mount Sinai's long and rich tradition of excellence. For over 7 decades, Mount Sinai has been awarding the medallion each year, honoring alumni, faculty, and administrators for their distinguished achievements. This year's honorees include a highly valued member of the Department of Medical Education, an internationally recognized researcher in virology, infectious diseases, and global health, a world-renowned expert in urologic oncology, and a pioneer in robotic radical prostatectomy surgeries, a dynamic leader in human resources, employee and labor relations, and operational strategy, and an esteemed leader within the health system who is also an expert in the diagnosis and management of challenging glaucoma cases and complex glaucoma surgery. These Jacobi recipients are exceptional physicians, visionary researchers, great educators, and talented administrators. They have worked to expand our understanding of biomedicine and ensure young physicians know how to apply that knowledge to heal their patients. They embody the aspirations of Mount Sinai to advance science and medicine in the name of better and more effective healthcare. Congratulations to the 2025 Jacobi Medallion recipients.
The culture of Mount Sinai has, for me, always been one of ground that is fertile, and if you don't see it, you can build it. To reimagine how to continue growing this workforce of clinician, educators, scientists, in a way that was grounded in the community and grounded in the service was always welcomed. Sinai allowed me to shoot for the stars because the ground was fertile for new ideas and creativity. This job has allowed me to surpass any thought or dream or imagined role.
Michelle Sainté-Willis is a highly valued member of the Department of Medical Education, providing expertise and leadership in all areas of operations, including resource management and all programs related to the MD degree.
At another institution, or even this one, chief operating officer might come close to describing the range of things that she has direct responsibility for. Usually people in that position, the best they can strive for is to do their administrative work. And that's kind of the ceiling, and Michelle breaks through that ceiling.
Michelle was instrumental in shifting the work and learning environment, creating a holistic, equitable, thriving environment to work and learn in.
When the students came to me to start EHOP, the East Harlem Health Outreach Partnership, which is the student-run free clinic, that spoke to me because the access to healthcare and education have always been important drivers in my mind. Students came to me and they wanted to start a summer camp for kids in East Harlem. It's called MedStart. And educating young Black and Latino students is always something that has been a passion of mine.
The legacy that Michelle Sainté-Willis will leave at Mount Sinai is that she was responsible for laying the foundation, continue developing and evolving into an anti-racist medical school.
There are many things in the last 20 years, including a pandemic, that we never would have survived as a school. Never, if it hadn't been for her. There was a massive manpower shortage at the institution, and we needed desperately to have scores of students, sometimes hundreds of them, who were eager to do something. Michelle was the mastermind for trying to figure out how the logistics of every one of those things needs to play out, and we couldn't have done it without her.
I don't think I have always seen myself in the institutional memory landscape. And I stand now here in this moment being recognized by some of the most powerful people in medicine. It feels really amazing.
There's no question to me that the school would be a profoundly different institution were it not for Michelle Sainté.
This award symbolizes for me that my contributions here have not only been meaningful, but have been impactful and sustainable.
What would attract someone to the field of virology? I think it's the promise to solve a puzzle and change the course of disease by putting the right pieces of information together and finding a cure. So the ability to change someone's life by identifying the right pathogen or preventing pandemic from occurring by intervening in a very succinct manner. As a virologist, we can have a tremendous impact in keeping our world safe.
Viviana Simon is internationally recognized for her groundbreaking research in virology, infectious diseases, and global health, with a particular focus on HIV, SARS-CoV-2, and the emerging viral pathogens.
My love of science is inspired by my love for medicine and the need to learn more. The work for which I'm recognized is taking place at the interface between basic research and the hospital. So we literally are doing work that starts at the bench and goes to the bedside, or the opposite, it goes from the bedside to the bench and back to the hospital. So it's really a circle where we learn from each other.
HIV/AIDS, especially when she started, it was a very complex problem, it was a death sentence. The aspect that Viviana did that is very unique is that she really tried to work with patients, and she really was very determined to really understand how is the virus able to stay in the patient for such a long time.
With Viviana's help, Mount Sinai really set up the foundation for COVID testing and immunity testing and helped us begin to develop an understanding of the early days of the pandemic.
We always thought that there would be another pandemic, so we built infrastructures and prepared for a pandemic. We had more tools than other academic centers at the time. We could test for antibodies.
Her ability to translate this deep knowledge of virology into the clinical setting and help connect the dots. Sinai was able to very rapidly roll out testing that could tell patients whether or not they had had COVID recently.
Receiving the Jacobi Award really means the world to me. Such an amazing honor. My greatest impact at Sinai has been to train the next generation of scientists and physicians and empower them to advance our knowledge in the area of infectious diseases.
I would definitely consider Viviana Simon an unsung hero of Mount Sinai.
Having the recognition of my peers gives me the courage to address important issues for society, to make this world safe from viruses. Our work hopefully will contribute to prevent the next pandemic. Here at Mount Sinai, I could become the scientist, the researcher I wanted to be.
I focused on something, and that something was how to take care of patients with prostate cancer. And I've been doing it for the last 20-30 years. My drive has been looking at the faces of families and the patients who are facing this dilemma of being given a news about prostate cancer. And that is the drive which every morning I think about what can we do to make it a little bit better.
Tewari is a world-renowned expert in urologic oncology and a pioneer in robotic radical prostatectomy surgeries. Since his arrival at Mount Sinai in 2013, the Petrie Department of Urology has expanded significantly to provide state-of-the-art services for the diagnosis, treatment, and prevention of a wide variety of urologic conditions.
I have a calling that I want to find cancer early when it's potentially curable, because this cancer doesn't shout out. This cancer doesn't declare that I'm there. And it's our responsibility to find this cancer, and not just find the cancer early, but to intervene only when it is needed.
Dr. Tewari is an intellectual phenomenon. He's a brilliant scientist, an amazing surgeon, highly skilled, and also a scholar. This combination of traits is quite unique and unusual, especially for a surgeon.
He's built the Department of Urology into a national and international powerhouse through fantastic clinical care, through his international conference he has and holds here every year in prostate cancer, and then through his research program. And now he's one of the top-ranked NIH-funded departments in the country.
One of the major contributions of Dr. Tewari has been the implementation and actually really designing surgery in minimally invasive formation in the context of robotic surgery.
Robotic surgery has resulted in better vision, precision, ability to reconstruct, ability to see structures in much more magnification so that you can see the nerves and you can spare the nerves.
This is really going to be one of his research legacies as he advances the field.
I think that what he has done is given patients a better quality of life for themselves, their partners, and their families.
One of the most important things he's done is he recognized that we have disparities in our community where certain people of certain socioeconomic levels and also living in certain neighborhoods really didn't have access to the proper care and early detection of the disease.
I thought it will be easier to find a cancer early if I show up at the doors of people where they are living. That was the thought behind the mobile unit, so that they can just come out, talk to my team, and get them tested.
The mobile van, it has produced change in paradigm, reaching out to communities that otherwise are afraid sometimes to come to the doctor, making sure that they feel safe, that they feel care. It's something that breaks the boundaries and brings patient care to another level.
He's a wonderful example of someone who's had a huge impact on our community at Mount Sinai and beyond that, New York City and the world.
By recognizing me as a Jacobi medal recipient this year, it touches your heart. They are recognizing my department, they're recognizing the care which we are giving to our patients and the research which we are doing to make an impact. It pushes you to focus on what led you to be here, and that reflection is the true award in my mind.
I work across the health system, and I feel like I understand all the different institutions, the diverse organization that we live in, the diverse employees that I work with, and I feel like yet we're all still connected as one family and one community. The greatness of Mount Sinai is truly its people, and I am proud to be a part of building this exceptional family.
Karen Tiger is a dynamic leader in human resources, employee and labor relations, and organizational strategy. Her work has significantly shaped the Icahn School's culture by ensuring a collaborative, inclusive, and progressive environment for faculty, staff, and trainees.
When people ask me on a day-to-day basis, what do you do? It's the most complicated thing for me to explain. I honestly feel like I do everything. I am the Dean for Faculty, Staff, and Trainee Relations. And that's exactly what I do. On any given day, I am strategizing with anybody from a leadership position, a dean, a chief medical officer, talking through an issue that we have, implementing a policy that we want to implement.
Karen's superpower is the ability to quickly establish rapport with literally anyone. She's a superb listener. She helps the other individual that she's speaking with come out of their shell and speak to her and share their concerns.
I don't know what I would do as a chair without Karen to rely on. She is a beacon, a shining light who promises to offer guidance and hope.
Karen is a wonderful minister of détente and respecting the differences between people, honoring those differences, and finding points of commonality.
I can't imagine how I would handle these situations without her really sage advice.
I see things that I want to advocate for. One of the things that I am truly proud of is the parental leave policy that was implemented. It allowed the faculty, the staff, and our trainees to have the ability to be with their newborns and also anybody that's a non-birth parent. So it's adoption, it's foster care.
She thinks about fairness at every turn and wants to be sure that everyone's needs are heard and represented.
Karen's exemplary leadership, commitment to Mount Sinai, dedication to serving all of us here at Mount Sinai are unparalleled.
I actually was shocked. I never in a million years thought I was going to be one of the recipients. What the Jacobi Medallion means to me is that I've really made a difference in their lives, recognizing the impact that I had on the people at Mount Sinai. That's why I'm honored by it, truly.
This is such an incredibly historic hospital. New York Icahn has had so many firsts, has achieved amazing milestones. We were the first hospital to use intraocular lens implant calculations in the care of patients. We were the first to introduce a microsurgical robot. So we've been really transforming ophthalmology care throughout the several centuries we've been in existence. I wanted to change the perception of New York Icahn from a small boutique hospital that did ophthalmology and ENT well to one that had an incredible impact on human health.
Jim Tsai is an expert in the diagnosis and management of challenging glaucoma cases and complex glaucoma surgery, and is the president of the New York Icahn Infirmary of Mount Sinai. Under his leadership, the infirmary has pursued groundbreaking research in ocular imaging, artificial intelligence, and genomics.
I believe the eyes are the window to human health.
He oversaw the Mount Sinai merger with the New York Icahn. He has helped to integrate ophthalmology within the fabric of the health system within Mount Sinai.
New York Icahn was independent. We practiced ophthalmology in a vacuum. Now we can actually see our impact across the health system. We can better determine whether patients with sickle cell disease are gaining benefits from their treatment by looking at their retinal images. We can better impact those with eye stroke by now linking our diagnostic services with the incredible, talented stroke team and interventional radiology team.
Because of Jim's leadership and vision, Mount Sinai has developed the largest residency program in the country and one of the best, but in addition, has encouraged more and more medical students each year to enter a career in ophthalmology.
I feel that receiving the Jacobi Medallion is validation that my vision for advancing ophthalmology in the entire health system and integrating New York Icahn into the health system is bearing fruit. We are developing new treatments that are having impacts on reversing visual loss, and that we are delivering incredible care to the community.
His legacy will be one of growth and preparation for a very different future of how healthcare will be delivered and offered.
Being here at Mount Sinai has been an incredible dream accomplished.